Antepartum, pregnancy. 1. Preeclampsia is when a pregnant woman develops high blood pressure, protein in the urine, and swelling after 20 weeks. The big concern is seizures. We monitor blood pressure and urine protein closely. If it gets severe, magnesium sulfate is given to prevent seizures. 2. Eclampsia is preeclampsia plus seizures. Once seizures start, the priority is airway safety. We still give magnesium sulfate, and usually delivery is the only cure. 3. Magnesium sulfate toxicity is dangerous. You'll see loss of reflexes, slow breathing, and low urine output. If this happens, stop the infusion and give calcium gluconate as the antidote. 4. Supine hypotension happens when a pregnant woman lies flat and the uterus presses on the vena cava, dropping blood pressure. We fix it by turning her on her left side. 5. Rh incompatibility matters when mom is Rh negative and baby is Rh positive. Mom's immune system could attack the baby's red cells. To prevent that, we give RhoGAM at 28 weeks and again within 72 hours after delivery. 6. Placenta previa causes painless, bright red bleeding. We never do vaginal exams because that can cause more bleeding. If it's complete previa, delivery will be by C-section. 7. Placental abruption is the opposite. It's painful, dark bleeding with a rigid abdomen and usually fetal distress. That's an emergency C-section. 8. Gestational diabetes is screened between 24 and 28 weeks. It's usually managed with diet, sometimes insulin. The big risks are big babies and complications at birth, so fetal growth monitoring is important. 9. Hyperemesis gravidarum is severe nausea and vomiting. It's not just morning sickness. These patients get dehydrated, need IV fluids, anti-nausea medicine, and electrolyte replacement. 10. Torch infections. Toxoplasmosis, rubella, cytomegalovirus, and herpes can cause serious fetal harm. Prevention is key. Avoid raw meat, avoid cat litter, and if mom isn't immune to rubella, vaccinate after pregnancy. 11. Syphilis in pregnancy is always treated with penicillin. Even if mom is allergic, we desensitize her, because no other drug is safe and effective for the baby. 12. Gonorrhea and chlamydia can cause blindness in newborns. We treat the mother during pregnancy, and all newborns get antibiotic eye ointment at birth. 13. Incompetent cervix means the cervix dilates early without pain. The treatment is a cerclage, which is a stitch placed in the cervix to hold it closed. 14. Ectopic pregnancy is when the fertilized egg implants outside the uterus, often in the fallopian tube. Symptoms include one-sided abdominal pain, bleeding, and sometimes shoulder pain if it ruptures. Management is methotrexate if caught early, or surgery if ruptured. 15. Hydatidiform mole is a molar pregnancy. Abnormal tissue grows instead of a baby. Signs include very high HCG levels and grape-like vesicles in the uterus. Treatment is removal, and then we monitor HCG for a full year. Pregnancy must be avoided during that year so we can detect abnormal regrowth. 16. Kick counts are used to track fetal movement. If there are fewer than 10 movements in 2 hours, that's concerning and should be reported immediately. 17. Non-stress test is a way to check fetal well-being. A reactive test means we see at least 2 accelerations in 20 minutes, and that's good. If it's non-reactive, we move on to a biophysical profile or contraction stress test. 18. Biophysical profile scores the baby on movement, tone, breathing, and fluid levels. A score less than 6 is concerning. If it persists, delivery is considered. 19. Amniocentesis is done after 15 weeks for genetic testing or lung maturity. Afterward, we monitor fetal heart rate in mom for bleeding or infection. If she's Rh negative, she gets RhoGAM. 20. Normal pregnancy labs include an increase in plasma volume and a decrease in hematocrit. That's called physiologic anemia, and it's expected. 21. Common discomforts of pregnancy include constipation, leg cramps, and back pain. The best teaching is fluids, extra calcium, support stockings, and regular exercise. 22. Nutrition teaching. Pregnant women should avoid deli meats, soft cheeses, and fish high in mercury like swordfish or shark. 23. Folic acid prevents neural tube defects like spina bifida. We recommend 400-800 micrograms daily before and during pregnancy. 24. Fundal height at 20 weeks should measure right at the umbilicus. After that, the fundal height in centimeters usually matches the weeks of gestation. 25. Weight gain in pregnancy should be 25 to 35 pounds for a woman with normal BMI. That's 2 to 4 pounds in the first trimester, then about 1 pound a week after that. 26. Domestic violence actually increases during pregnancy. Always screen privately and provide resources. 27. GT-PAL system, Gravida, total pregnancies, term, preterm, abortions, living children. Intrapartum labor and delivery. 28. Stages of labor. The first stage is dilation, 0 to 10 centimeters. The second is delivery of the baby. The third is delivery of the placenta. The fourth is the recovery stage. 29. True labor is regular contractions with cervical change. False labor has irregular contractions that stop with rest and do not change the cervix. 30. Early decelerations on the fetal monitor mean head compression. That's normal, no intervention needed. 31. Variable decelerations are caused by cord compression. We reposition mom, give oxygen, and sometimes do an amnio infusion if ordered. 32. Late decelerations mean uteroplacental insufficiency, which is dangerous. Turn mom on her left side, stop oxytocin, give oxygen, fluids, and notify the provider. 33. Fetal tachycardia, heart rate over 1 in 60, can mean infection. We check mom's temperature, give oxygen, and call the provider. 34. Cord prolapse is when the umbilical cord slips out, causing bradycardia in the fetus. Put mom in knee chest or Trendelenburg, lift the presenting part off the cord, and prepare for emergency C-section. 35. Uterine rupture is a sudden tearing pain with loss of contractions and fetal distress. It's life-threatening. Emergency C-section is required. 36. Shoulder dystocia is when the baby's head delivers, but the shoulders are stuck. We use the McRoberts maneuver, legs flex to chest, and apply suprapubic pressure. Never use fundal pressure. 37. Precipitous labor means delivery in less than 3 hours. Risks are postpartum hemorrhage for mom and distress for the baby. We monitor closely. 38. Oxytocin induction can cause tachysystole, which is more than 5 contractions in 10 minutes. If that happens, stop the oxytocin, give oxygen, and reposition mom. 39. Epidural complications often include low blood pressure. To prevent this, preload with IV fluids and monitor blood pressure. If severe, give oxygen and ephedrine. 40. Betamethasone is a steroid given to moms at risk for preterm delivery. It helps the baby's lungs mature. We monitor for maternal hyperglycemia. 41. Tocolytics like terbutaline, nifedipine, or magnesium sulfate are used to stop preterm labor. We monitor both mother and baby for side effects. 42. Amniotomy means breaking the water, artificial rupture of membranes. We always check fetal heart rate immediately afterward and watch for infection. 43. Chorioamnionitis is infection of the amniotic fluid. Signs are fever, foul-smelling fluid, and maternal or fetal tachycardia. Treatment is IV antibiotics and delivery. 44. Amniotic fluid should be clear or straw-colored. Green fluid means meconium, which signals fetal distress. Foul odor means infection. 45. Vaginal birth after C-section, VBAC, carries a risk of uterine rupture. If signs appear, stop oxytocin and prepare for surgery. 46. Internal monitoring with fetal scalp electrodes or intrauterine pressure catheters is contraindicated if mom has HIV, herpes, or hepatitis because of transmission risk. 47. Bishop score is used to decide if induction is favorable. A high score means the cervix is ready. 48. Leopold maneuvers are the palpation techniques we use to determine the baby's position and presentation. 49. Station describes how far the baby's head has descended. 0 means engaged at the ischial spines. +5 means crowning. Postpartum hemorrhage is blood loss over 500 milliliters with vaginal delivery or over 1,000 milliliters with a C-section. The first steps are fundal massage, giving oxytocin, and fluids. If it doesn't stop, call for additional help. 51. Uterine atony is the most common cause of postpartum hemorrhage. The uterus feels boggy and soft when it should be firm and contracting. The first step is to massage the fundus. If the bladder is full, empty it because that can prevent the uterus from contracting. Then continue oxytocin as ordered. 52. Mithyrgene is another medication for postpartum hemorrhage, but it cannot be given to women with high blood pressure. Always check blood pressure first. 53. Hemabate is another uterotonic, but we never give it to women with asthma because it can cause severe bronchospasm. 54. Misoprostol, also known as Cytotec, can also be used to treat postpartum hemorrhage. It may be given rectally, orally, or under the tongue, depending on the situation. 55. Fundal assessment is critical. After delivery, the uterus should be firm, midline, and shrinking by about 1 centimeter per day. If it feels boggy, massage it. If it is off to the side, empty the bladder. 56. Lochia is the vaginal discharge after delivery. It changes in stages. Rubra, red, 1-3 days, serosa, pink or brown, 4 to 10 days, and alba, white or yellow, beyond 10 days. A foul smell, large clots, or very heavy bleeding should always be reported. 57. Endometritis is an infection of the uterine lining. Symptoms include fever, foul-smelling lochia, and uterine tenderness. Treatment is IV antibiotics and fluids. 58. Mastitis is an infection in the breast, usually from a blocked duct. The breast is painful, red, and swollen, and the woman may have a fever. We treat it with antibiotics and warm compresses, but we encourage her to keep breastfeeding because that helps clear the infection. 59. Thromboembolism is a risk postpartum because of increased clotting factors. Signs include calf pain, swelling, and redness. Treatment is bed rest and anticoagulation. 60. Pulmonary embolism is a clot that travels to the lungs. Symptoms include chest pain, shortness of breath, and tachycardia. This is an emergency. Give oxygen, call the provider, and expect anticoagulation. 61. Urinary tract infections are common after delivery due to catheterization or urinary retention. Treatment is antibiotics, fluids, and good perineal hygiene. 62. Postpartum blues are mild mood swings, irritability, or crying spells in the first 2 weeks. They are normal and usually resolve with rest and support. 63. Postpartum depression lasts more than 2 weeks and interferes with daily life or bonding. It requires professional treatment. 64. Postpartum psychosis is the most severe. Women may have hallucinations or delusions, and there is a risk of harm to the baby. This is an emergency and requires immediate hospitalization. 65. Breastfeeding teaching. Newborns should feed every 2 to 3 hours. Always break the latch with a finger rather than pulling the baby off, and alternate breasts with each feed. 66. Formula feeding. Bottles should never be propped because that risks choking. Any unused formula left in a bottle after an hour should be discarded. Newborn 67. APGAR scoring is done at 1 and 5 minutes. We look at heart rate, respiratory effort, muscle tone, reflex irritability, and color. A score below 7 means resuscitation is needed, usually warming, stimulating, suctioning, oxygen, and sometimes bag mask ventilation. 68. Normal newborn vital signs are a heart rate of 110 to 160, respirations of 30 to 60, and temperature around 36.5 to 37.5 degrees Celsius. 69. Cold stress in newborns can cause hypoglycemia and respiratory distress. We prevent this with skin-to-skin care, warm blankets, or a radiant warmer. 70. Hypoglycemia presents with jitteriness, poor feeding, or lethargy. The treatment is feeding or IV glucose if severe. 71. Vitamin K is always given by injection after birth to prevent bleeding because newborns don't have enough clotting factors yet. 72. Erythromycin eye ointment is applied after birth to prevent infection from gonorrhea or chlamydia. 73. Jaundice that appears after 24 hours is physiologic and usually harmless. Jaundice before 24 hours is pathologic and must be evaluated. If bilirubin is high, treatment is phototherapy. 74. Phototherapy care requires the baby to wear eye shields, stay well hydrated, and have temperature monitored often. 75. Meconium aspiration can happen if the amniotic fluid is green. Suction the airway before stimulating the baby to breathe, and be ready for resuscitation. 76. Respiratory distress syndrome is common in preterm infants due to lack of surfactant. Treatment includes giving surfactant directly and providing oxygen support. 77. Transient tachypnea of the newborn is temporary fast breathing, usually resolving within 72 hours. Treatment is supportive care and oxygen as needed. 78. Neonatal abstinence syndrome occurs when a baby is withdrawing from maternal drug use. Signs include high-pitched crying, tremors, and irritability. We swaddle, keep stimulation low, and sometimes give medication. 79. Fetal alcohol syndrome causes microcephaly, a thin upper lip, and growth issues. Treatment is supportive with careful monitoring of development. 80. Hypocalcemia in newborns can cause jitteriness and seizures. Treatment is calcium supplementation. 81. Necrotizing enterocolitis is a dangerous condition in preterm infants where the bowel becomes inflamed. Symptoms include a distended abdomen and feeding intolerance. Treatment is stopping feeds, NG suction, IV fluids, and antibiotics. 82. Congenital heart defects often present with cyanosis, murmurs, or poor feeding. Babies need oxygen monitoring and echocardiograms, with surgery if necessary. 83. Spina bifida shows up as a sac on the spine. We cover it with a sterile moist dressing until surgery and monitor for infection. 84. Hydrocephalus causes a bulging fontanelle and rapid head growth. We measure head circumference daily and prepare for shunt placement. 85. Cleft lip and palate cause feeding difficulties. Babies should be fed upright with special nipples and burped often until surgery can be done. 86. Newborn reflexes include Moro, rooting, sucking, grasp, and Babinski. Babinski is normal up to 1 year. 87. Normal newborn weight loss is up to 10% of birth weight in the first week, but babies should regain it by 2 weeks. 88. Phenylketonuria PKU screening is done after the baby has had protein. If positive, the baby needs a low phenylalanine diet. 89. Sudden infant death syndrome. SIDS prevention includes putting the baby on the back to sleep, using a firm mattress, and never bed sharing. 90. Car seat safety. Infants should remain rear-facing until at least 2 years of age. 91. Hepatitis B prophylaxis. If mom is positive, the baby must receive the hepatitis B vaccine and immunoglobulin within 12 hours. 92. Circumcision care. A yellow crust over the site is normal healing. Never remove it. 93. Cluster care is especially important for babies withdrawing from substances. It helps reduce stimulation and stress. 94. Shaken baby syndrome can cause fatal brain injury. Parents must be taught never to shake a baby and to use safe coping methods when the baby cries. 95. Bathing. Only sponge baths until the cord falls off. 96. Cord care. Keep it clean and dry. It usually falls off within 10 to 14 days. 97. Hypothermia in newborns can cause apnea and bradycardia. Keep them warm and monitor closely. 98. Polycythemia. Too many red blood cells can cause jaundice. Monitor hematocrit, keep the baby well hydrated, and use phototherapy if bilirubin rises. 99. Anemia of prematurity is common in preterm infants. They may need iron supplementation. 100. Warning signs in newborns include poor feeding, lethargy, unstable temperature, or breathing difficulty. Parents should be taught to seek medical care immediately if these occur. HELP syndrome. This stands for hemolysis, elevated liver enzymes, and low platelets. It's a severe complication of preeclampsia. Women will often present with right upper quadrant pain, nausea, vomiting, or just a vague sense of malaise. It's dangerous because it involves both liver injury and clotting problems. The treatment is delivery, often immediately. 1 or 2. Oxytocin. We use oxytocin to induce or augment labor. It must always be given by infusion pump. We monitor the fetal heart rate and contractions closely. The risks are uterine tachysystole, more than 5 contractions in 10 minutes, maternal hypertension, and water intoxication. If we see fetal distress or tachysystole, we stop the infusion, turn the mother on her side, give oxygen, provide IV fluids, and call the provider. 103. Torch infections. Torch stands for toxoplasmosis. Other infections like parvovirus B19, varicella zoster, or syphilis, rubella, cytomegalovirus, and herpes simplex. These infections can cause serious fetal abnormalities. We prevent them by simple measures like avoiding raw meat and cat litter with toxoplasmosis, and by giving the rubella vaccine after delivery if the mother is non-immune. 104. Group B streptococcus. Mothers are screened between 35 and 37 weeks. If they test positive or if their status is unknown during labor, they receive IV antibiotics, usually penicillin, to prevent neonatal sepsis, pneumonia, or meningitis. 105. Postpartum hemorrhage. We define this as more than 500 milliliters of blood loss after a vaginal delivery, or more than 1,000 after a C-section. The most common cause is uterine atony, a boggy uterus that is not contracting. Delayed hemorrhage can be caused by retained placental fragments. Risk factors include multiple pregnancies, prolonged labor, uterine distension, and a history of PPH. Nursing interventions include fundal massage, giving oxytocin, IV fluids, and alternative uterotonics if needed. 106. Endometritis. This is infection of the uterine lining postpartum. The mother may have fever, foul-smelling lochia, tachycardia, and uterine tenderness. It's treated with IV antibiotics and fluids. 107. Folic acid. All women of childbearing age should take at least 400 micrograms daily. In pregnancy, the need rises to 600 to 800. Sources include leafy greens, beans, fortified cereals, peanut butter, and rice. Its purpose is to prevent neural tube defects, such as spina bifida. 108. Isotretinoin. You may know this drug as Accutane. It's category X, absolutely contraindicated in pregnancy because it causes severe birth defects. Women on isotretinoin must have 2 negative pregnancy tests before starting and must use 2 forms of birth control. 109. Pregnancy as a hypercoagulable state. Pregnancy naturally increases clotting ability to protect against hemorrhage at delivery, but it also raises the risk for deep vein thrombosis. Early ambulation postpartum is key. 110. Normal fetal monitoring. A normal fetal heart rate baseline is 110 to 160 beats per minute. Moderate variability, that's 6 to 25 beats, is reassuring. Accelerations, a rise of 15 beats for at least 15 seconds, mean healthy fetal movement. Late or variable decelerations are concerning and may indicate distress. 111. Contraindication to vaginal exam. Do not perform a vaginal exam if the mother has unexplained vaginal bleeding. This could worsen placenta previa or abruption. 112. Placenta previa. This presents with painless vaginal bleeding. The placenta is covering the cervix. We avoid vaginal exams and prepare for C-section. 113. Placental abruption. This is different. It causes painful, dark vaginal bleeding, a rigid abdomen, and frequent contractions. We monitor maternal fluid status and fetal heart tones and prepare for emergency delivery. 114. Intake and output with oxytocin. It's important to monitor fluids because oxytocin has an antidiuretic effect and can cause water intoxication. 115. Quickening. This is the mother's awareness of fetal movement. In first pregnancies, it's felt around 18 to 20 weeks, and earlier in women who've been pregnant before. 116. Trimester definitions. The first trimester is weeks 1 to 12. The second is weeks 13 to 26. The third is 27 to the end of pregnancy. 117. Magnesium sulfate. We use it to prevent seizures in preeclampsia and eclampsia. The therapeutic level is 4 to 7 millimERs per hour. Toxicity shows up first as loss of reflexes, then respiratory depression, decreased urine output, and even cardiac arrest. Always monitor reflexes, respirations, and urine output. Keep calcium gluconate at the bedside as the antidote. 118. CPR in pregnancy. You displace the uterus to the left and perform compressions slightly higher on the sternum. This avoids uterine pressure and maintains circulation. 119. Amniotic fluid. It is produced mainly by the fetal kidneys. Its 2 big purposes are to prevent cord compression and to promote lung development. 120. Oligohydramnios. Low amniotic fluid can be caused by fetal kidney problems or fluid leakage. Risks include cord compression and pulmonary hypoplasia. These mothers require continuous fetal monitoring, possibly amnio infusion, and often extra personnel at delivery. 121. Placenta previa and ultrasound. Around 36 weeks, an ultrasound is done to confirm placental location before planning delivery. 122. Trisomy 18 and 13. These conditions carry a very poor prognosis. Infants usually survive only weeks. Care is palliative and focused on comfort. 123. Advanced maternal age. Older mothers have an increased risk of having a child with Down syndrome. Genetic counseling and screening are recommended. 124. Full cervical dilation. 10 centimeters are required for delivery. 125. GT-PAL with twins. Twins count as one pregnancy in the term or preterm category, but the living children count separately. 126. Medication timing in labor. It's important to check what medications were given in the past 4 hours. If opioids were given close to delivery, the newborn may experience respiratory depression. 127. Term pregnancy. A pregnancy is considered full term at 37 weeks. 128. Fetal alcohol syndrome. These infants have characteristic facial features: microcephaly, short palpebral fissures, a flat midface, smooth philtrum, and a thin upper lip. They are at risk for intellectual disability and developmental delay. 129. Smoking in pregnancy. Smoking increases the risk of sudden infant death syndrome, low birth weight, preterm birth, and perinatal loss. Mothers should be counseled and supported in quitting. 130. Depakote. Also known as valproic acid, this drug is contraindicated in pregnancy. It is linked to spina bifida and other neural tube defects.